Things you always start out with, like we discussed earlier: inspection, palpation, range of motion. So what we want to do is assess the cervical spine range of motion. What you want to do is compare one side to the other. So if you could look as far as you can that way. Good. As far as you can towards me. Excellent. Those seem symmetric. Touch your chin to your chest. Extend your neck back. All right. Look straight ahead. Can you take your ear and touch it to this shoulder? Well, keep your shoulder there, exactly. So this is again where we need to stabilize. And now on the other side, can you touch your shoulder?
Not completely.
All right, good. All right, so that's our inspection. Palpation, you're gonna palpate gently, because you don't know if the patient's gonna be uncomfortable or not. But you wanna gently palpate the tissues with your bare hands, which are clean and washed. Directly skin on skin, you wanna note for any tissue texture changes, warmth, color changes. This is gonna apply to all areas that you examine today. And then, of course, inspection, what I would check is shoulder heights. Typically, they're not going to be equal. Usually, if you're one hand dominant, that side might be either overdeveloped or sometimes even underdeveloped. If someone carried a backpack on their right hand side, you're often going to see that shoulder depressed. Also, with range of motion, I want to look at the spine from a lateral view. You can see on this young man here, he has a slightly increased thoracic kyphosis. He kind of pitches his cervical thoracic junction forward just a bit. Next, we're going to test motor strength. This will let us know if we have any weakness in the muscles or if there's some neuromuscular weakness as well. So first thing we want to do is shoulder shrug. So if you can, just shrug your shoulders up. There you're looking at C4. Next, C5, 6. Can I have you abduct your shoulders for me? This is C4, 5 rather. Okay, now flex up your biceps. This is 5, 6. One side up, hold it, do the best you can for me. One side to the other side. Then we want to do 6, 7. Can I have wrist extension? Compare one side to the other. Can I have you just relax, let me support all your weight. Now we're going to do elbow extension. When I tell you to, just extend your elbow. Nice job. Compare that to the other side. You can see that I isolated it, and I'm also having him work against gravity because strength testing is on a 0 out of 5 scale, 0 being no strength, 5 being full strength, and then you want to get to 3 minimum, which is anti-gravity. So this way you have him working totally against gravity. So extend on this side. Great. Now hand intrinsics for C8, T1. Spread your fingers real wide. Now obviously if I just crush his hands, I'm going to be able to do that because I'm stronger. My hand grip is going to be stronger. So you test, you can test 2 things. You can test grip, so squeeze real tight. Turn your hands over, give me a good squeeze. All right, stop. And now spread again. And you just want to see his abductors, pinky to pinky. So the same strength, the same strength. Next we would test reflex testing. C5 at the biceps, 6 at the wrist extensors, and then C7. I don't have a reflex hammer, so we're going to use...
Do you have a hammer?
I have one in my locker.
There you go. You can use whatever you have handy, or I'll try with fingers first. Nice and relaxed. Let me support all your weight. Nice job. You can see that I get a little bit of a contraction there. I'm satisfied with that. One side to the next. Nice and relaxed. Let me hold your weight. You're still holding your own weight. There you go. Not that I'm meaning to call you out on anything. Good. And I can feel a little twitch here, so I'm happy. Biceps. There we go. And then finally we can do brachioradialis. Brachioradialis is what I tell patients to get is in the position of reverse karate chop, so or karate chop, and you can test strength with reverse karate chop, or make sure you tap right there, which is what we're going to do. Nice twitch. Safe. Good. Finally, we're going to go back to the cervical spine. One of our tests we talked about earlier is the Sperling's maneuver for cervical radiculopathy. That involves extension and rotation to close the size of the foramen on the affected side that the patient's describing their symptoms. Does that make anything shoot into your hands? Okay. Extension. And the other side. That's good. I personally don't like the compression like we talked about because that's usually enough. And if somebody has something, a rheumatologic disease, and they have some instability that's inherent to their spine, you don't want to make it worse. Okay? You don't want to make their symptoms worse. Upper motor neuron signs. For now, we can check Hoffman sign. So we can take your thumb and you're going to flick the middle or even index finger to see if there's a contraction, a flexion at the thumb there. I don't see that. So there's nothing there. You want to check ankle clonus, which is also upper motor neuron. Can you scooch forward
Yep.
for me? Great.